So Micah, as you know, a lot of people have questions about who actually benefits from the Affordable Care Act in Utah. Let's walk through that on this very conveniently located whiteboard. So here we are in Utah, population about 3 million. The first population that really benefits from the ACA are those that have to go out and buy insurance on their own, people who do direct purchase of insurance. These are people who are self-employed, running their own businesses, or just don't get insurance from their employer. It's actually between about 5 and 6% of the population of Utah, which we think works out to a bit around 300,000 Utahns. Currently, right now in Utah, we have about 200,000 people actually enrolled in private market insurance. So we've done quite well at getting those people enrolled, but there's still quite a few folks that haven't signed up. So that's the first category that benefits. The next category of benefits are those that have employer-based insurance, which is actually about 60% of Utahns. And that's a heck of a lot of folks. That's almost about 2 million Utahns that get insurance from their employer. And that includes the employees as well as their dependents. So how do they benefit? Well, for one thing, if they ever to leave their job or lose their job, they wouldn't be discriminated against because of pre-existing conditions. And that's an important thing because that allows people to have peace of mind as they transition to a new job or even start their own business. They're also protected, many of them, by having 10 essential health benefits, a new part of their employee benefits. So maternity care, prescription drug benefits, hospitalization, all of that is now embedded in many small group plans where it used to not always be there. So those are some major benefits that these folks get. In another population, Micah, as you know from your work, the benefits are those that are on Medicaid. Could you tell us a little bit about that population?
The ACA changed it so people no longer had to spend down their assets to be able to get on Medicaid when they really need to. And as you know, Medicaid covers children, senior citizens, people with disabilities, a number of pregnant women and other families living in poverty or living below the poverty level. The ACA, as you mentioned earlier, brought in all of those essential health benefits, and also when it did that, tied in the benefits that could be offered through Medicaid under the ACA. One of the biggest things that it gets talked about in Utah as far as Medicaid and ACA is the Medicaid expansion, or the coverage gap as it has come to be known. And this has been in the news for the past few years because Utah could have covered up to 138% of the federal poverty level with Medicaid. And that was an option that was provided under the law or under ACA. What happened is Utah decided not to cover that population, but to do research and look into data, do analysis. That culminated with the passage of House Bill 437. That indicated that we were going to do what people called a mini expansion. We're going to cover a slightly bigger part of the population that has dependents. We were going to help people who were chronically homeless, were involved with the criminal justice system, or who were receiving mental health or substance use disorder treatment. Originally, when this plan came out, it was supposed to cover 16,000 people. And that would be 16,000 out of a greater almost 90,000 Utahns who were stuck in this coverage gap. So, House Bill 437 wanted to cover 16,000. We looked at the data, we looked at how much that was going to cost, and we realized it really wouldn't be able to cover that many people. So we hoped it would cover 12,000 people. Time went on. The Department of Health submitted their 1115 waiver to HHS or CMS on the federal level to try and get approval. After further analysis, we deemed that it looks like that plan wouldn't actually cover even the 12,000, but maybe 9,000. Still, we didn't have approval to even go forward with this mini expansion. So we waited. The election in November happened, the previous administration left, and the job to decide on Utah's 1115 waiver fell to the new administration, which hasn't acted. However, during our current legislative session, we decided that we would cover the approximately 3,000 adults with dependents or extend the level of the federal poverty limit that we would cover.
It's really interesting you brought up the gap, Micah, because that is a big part of what we're trying to fix here in Utah, and something UHPP has been involved in for years. So we've got 90,000 people living in the gap. Originally, we were going to get a plan that was going to cover them all, Healthy Utah plan. That ended up going nowhere. We eventually got HB 437, which UHPP grudgingly supported because we were like, let's help a couple people out here. Originally, it was supposed to help about 12,000 people get out of the gap, but it didn't. It wasn't going to cover that many. It was going to cover a lot less, and now we're down to about 3,000 people that are going to be able to get out of the gap, which still leaves quite a few that are in the gap that we still need to help, and that's still a task that UHPP is engaged in. But let's go back to other folks that benefit from the ACA. This is a population not a lot of people realize, and that's grandma and grandpa, senior citizens, those on Medicare. Those are about 300,000 Utahns that are on Medicare. They benefit by having the prescription drug donut hole closed. This is something that the ACA did in a bargain with pharmaceutical companies. Senior used to be cutting pills in half, running out of money halfway through the year when they had to pay 100% of their prescription drug benefits. The ACA has been whittling down that prescription drug donut hole. So right now it's 50% of what it was in 2014. In another couple of years it'll be at zero, saving seniors an average of $1,500 to $2,000 a year on their prescription drugs. And that's really important when you're on a fixed income. So those 300,000 seniors definitely benefit from the ACA. Now there's one other thing but I'd like to add, but you know what? We've only got 3 markers here at UHPP. If we had a little bit more money through LoveGive, Utah, maybe we could afford some more. And you know what? This green one doesn't even work. So really, we've just got 2 markers here. So another reason why we could use a little bit of support. We're a scrappy nonprofit, and we get by with 2 markers. But boy, imagine what we could do if we had a couple more. So there we have on our beautiful whiteboard a depiction of all those that benefit from the Affordable Care Act here in Utah. Not a lot of people realize that. A lot of folks think that Obamacare is just for low-income folks, it's a government program, it's for the other person, not realizing when they go to the doctor and they get their well child check or they get their flu shot, the reason that it's free is because of the Affordable Care Act. And that's why UHPP is here. That's kind of the work we do, is to make sure that more and more people can benefit from those consumer protections, more affordable insurance, and learning how to use that insurance more efficiently. That's what UHPP does.